Welcome back. June is Men's Health Month, and with that comes men's mental health. Dr. Krista Fritson, UNK professor, psychologist, and director of Beacon of Kearney, joining me now. So thank you for being here, doctor.
Hello, thanks for having me and continuing the discussion about mental health.
Of course. Okay, let's start off with statistics. So it shows that about 1 in 10 men have some sort of mental health issue, yet we tend to not really talk about men's mental health much.
Yes, I think that is really a difficult thing that's going on in our world is men are consistently less likely to talk about it, and people tend to, in general, minimize mental health. But with men not talking about it, they're underdiagnosed typically, and it really is going to be a continued effort to open those doors of discussion and communication and recognizing that it is not a sign of weakness or any difficulties that are beyond the typical person in general.
hmm So when talking about some of those different mental health issues, what are some of the most common that you're seeing?
Well, typically, depression is underdiagnosed and anxiety is underdiagnosed because there's ways that men and other people can use other substances or distractions to kind of avoid. So maybe overactivity with sports or work or substance use, which can happen in all populations, but it's much more of a tendency for men.
Let's talk about some of the symptoms, perhaps. Like you said, changing in behavior, but maybe when it comes to that anxiety and depression, what should people kind of be looking out for? Or if they're having some concerns, what would maybe be some telltale signs that something's really going on?
A huge one is if people start giving things away, especially if they've been very depressed and have change in, say, mood, motivation, lower energy levels. If there's a change in either excessive sleep or unable to sleep, same with appetite, those extreme changes or extremes in behavior or experiences are super important. If a person is not experiencing pleasure, like they used to do certain activities, and now they have just become more recluse or not engaging in activities that they used to enjoy, or just have a generally down affect or emotional expression consistently, those would be some sure tell signs that we'd want to ask questions and see what's going on for a person.
hmm like we kind of mentioned, men can tend to be a little bit more closed off or held back. If we do have concerns and they're just saying, oh, everything's fine, nothing's going on, what do you suggest somebody do in that situation, perhaps for a loved one?
Well, first of all, I would suggest ask again. Sometimes it's easy to shrug it off, but if you're there and you're insistent and say you care, that can make a huge difference. If we don't want to hear the answer, we don't have to hear the answer. So I say stay persistent and let them know that you care and no judgment. But then in terms of resources, most communities in Nebraska have a behavioral health resource center like Region 3, Region 2 behavioral health centers. Those are great resources that can give you a slew of opportunities from outpatient therapy to other sources of support, as well as clergy, if there's a trusted pastor or pastoral care. Uh, the first connection oftentimes is a primary care physician, and we are getting much better at our primary care physicians in clinics and in agencies to be much more aware of the need for mental health. And that's a difficult thing to do, but to ask that primary care provider if there's resources or what resources are available. There's also the 988 line. The 988 is a national hotline, but it's also an information line. So we can use it in time of crisis, but nobody will like show up at your door. You just have a place to talk. But you can also call just to get information and resources in your area.
Okay, lots of good information, something really important to be talking about, especially during this Men's Mental Health Month. So thank you so much, Dr. Fritson.
Thank you. You have a great